Hello and welcome. It's Friday, March 4th here in Korea, and you're watching the Daily Report. Now, regardless of the fresh high in daily infections here in the local front, authorities have decided to ease business hours at a number of establishments, including restaurants and cafes. We have details after a check on the global COVID-19 tallies. So let's begin with Korea's record number on this Friday.
Right, Sunny, we are entering the weekend with more than 266,000 cases that have been tallied as of 12 a.m. this Friday, and that includes 2,666,771 domestic transmissions. And with the majority of those being identified as the Omicron variant. And if we compare the figure to the day before, it is quite a surge after we dropped on Thursday to below 200,000. So with that, we have 2 days here in Korea where we have surpassed that milestone. And with that, the average number of daily cases in the past 7 days has now surpassed 180,000. And by region, there have been record highs posted in many places across the country. We're seeing the capital Seoul at close to 60,000 cases in just a day, more than 76,000 in Gyeonggi-do province. And although there's been a slight drop in Gwangju, this city has surpassed 100,000 when it comes to its accumulated caseload, and Jeju Island also surpassed 40,000 this Friday. Unfortunately, we also have a record high in the number of single-day deaths. 186 people have lost their lives in the past day due to the coronavirus, and the total number in Korea, the total number of infections now stands at above 3.9 million. The number of patients in severe or critical condition has been in the 700s for the 5th straight day, and now close to 800 this Friday. And the vaccination process is slowing down somewhat because most of the nation's population has already received either their first or second dose. But on the booster shot front, we got more than 65,000 people who got their additional dose the day before on Thursday. Now let's move over to the global figures. There's been a rise by 1.7 million new cases added in the past day. And also here, a grim milestone, 6 million people now, more than 6 million have lost their lives due to this virus. And if we go over to the table of the countries with the 20th highest number of cases, now we're seeing that South Korea has become the country that has the 20th highest caseload, as I said, with more than 3.9 million. And also, as of noon Korea time, Korea posted the highest number of daily infections in the past day, just followed by Germany, which also had over 200,000 cases in the past day. And those are the general updates I have for now, but I'll see you back in a bit. Sunny?
All right, so thank you for now. And while we wait for her to get seated, I have Kim Bo-kyung here in the studio with me with details about the latest shift in Korea's social distancing guidelines. Bo-kyung, good to see you again.
Thank you for having me, Sunny.
Right, so do share the details with us then.
Well, Sunny, first of all, the social gathering cap of maximum 6 people and 10 p.m. shutdown orders were set to expire on March 13th. However, these guidelines have been relaxed earlier than scheduled. The new rules in place will allow businesses to remain open until 11 p.m., 1 hour longer than before, while maintaining our social gathering cap of 6 people. The changes will be applied beginning on Saturday, March 5th. And on the medical front, 50% of the country's ICU beds are now in use as Korea continues to approach its Omicron peak. However, health authorities say that unlike the Delta variant, the rate of severe illness and death has been kept relatively low, allowing our healthcare system to stay in control of the situation. With the government's focus shifting towards preventing hospitalizations and deaths, a new approach was needed in its containment strategy. The government was also wary of the financial impact of social restrictions on small business owners.
We have taken into account the difficulties small business owners were facing for a long time, despite the expansion of payments for damage and partial easing of social distancing measures.
The new guidelines will apply to 12 types of public venues, including restaurants, cafes, PC rooms, and movie theaters until March 20th. The authorities added that this latest easing was made conservatively, as health experts had warned that it is still too early for full-scale relaxing of measures. However, they hinted that much more comprehensive easing or lift of restrictions would take place in the next round of changes.
Right. And Pogyang, early voting is well underway here in the country. Keeping that in mind, do tell us about the protocols in place for COVID-19 patients.
Well, Sunny, health authorities will allow those who are either infected or are self-isolating to leave their homes or other accommodations on March 5th for early voting and election day on March 9th. However, they must cast their ballots within a specific time frame. On the 5th, for the first time, voters may temporarily leave their homes or quarantine sites at 5 p.m. and must arrive at polling stations before 6 p.m. And on the 9th, voters may also leave at 5 p.m. and voting will take place between 6 p.m. and 7:30 p.m. on that day. They can either walk, drive their personal vehicles, or use special designated taxis to get to the stations, as they're not allowed to use public transportation. And text notifications that contain voting instructions will be sent to those eligible from Friday noon until 4 p.m. on Wednesday.
Voters subject to special voting can vote at temporary polling stations after showing their identification card, the official government text message, or confirmation or isolation notice message.
Right. Meanwhile, so among those who will be voting separately due to COVID-19 is one person we all know, right?
Right, that is Prime Minister Kim Bu-kyum, who recently transmitted the virus. And he said he's planning to cast his ballot for the presidential election just like all other people in quarantine, according to the guidelines by the health authorities. And he is expected to go to a polling station near his residence for the early voting on the 5th, so on Saturday. And Prime Minister Kim Bu-kyum tested positive for COVID-19, meanwhile, on Thursday, and is currently said to be recovering at home. Kim said he feels a little under the weather and has a sore throat. Kim took to social media to tell the nation's people that he is fine and that he has just become one of the tens of thousands of citizens getting infected every day, and said that his at-home treatment will be an opportunity to empathize with other COVID-19 patients. The Prime Minister is expected to continue his duties online through phone and video calls, while those that inevitably have to be done in person have been cancelled. And that's also why earlier in Pogyang's report we saw how the Interior Minister Jeon Hae-chol held a briefing at the Central Disaster and Safety Countermeasure Headquarters earlier this morning, filling in for the Prime Minister.
Right. And regarding efforts to ensure safety at polling stations, Pogyang, I understand concerns are still there, though.
That's right. Voters with a suspected infection or those who are waiting for their PCR test results are not considered as a confirmed case, so they will be voting at the same time as everyone else. And amid the Omicron wave, coupled with test results coming out later than usual due to delays, there are concerns that this election could spark another surge.
The number of people getting PCR tests is going over 850,000. Up to now, we needed to wait around 12 hours to know results, but now it takes 18 hours. These people could be the cause of more infections.
And adding on to that, people with positive rapid antigen test results that haven't been validated by a PCR test can still vote normally, so this could be another reason for concern.
Right, I see. And on a more stern note, Pogyang, I hear authorities have also vowed to crack down on voters who abuse their special voting rights.
That's right, Sunny. COVID-19 patients who wish to vote cannot go anywhere else aside from the polling stations and must return home right away after casting the ballots. Anyone who violates this rule could face up to 1 year in prison and a maximum fine of around $8,000. Regional authorities are stepping up their monitoring efforts, although the government has admitted that the large number of people hitting the polling stations on election day could pose serious enforcement challenges.
All right, Pogyang, as always, thank you very much for the coverage. Have a safe weekend.
Thank you.
Right now, so what is the latest government assessment with regard to Korea's COVID-19 situation?
Well, Sunny, officials tried to explain in further detail why a partial ease in the social distancing measures was inevitable, and especially why now, as we have not reached the peak of the Omicron wave yet. Now, as Pogyang touched upon before, the different characteristics of the waves, namely the Delta and the Omicron wave, do seem to play a part, with officials citing recent analysis from the KDCA and the Korea Institute of Science and Technology that shows that the effects easing of social distancing measures will have no more than a 10% impact in the peak of the Omicron wave. Health Minister official Lee Ki-il did note, though, that during the discussions held among the government-private committee in charge of planning the transition to our normal lives, the Prevention and Health Subcommittee did mention the easing could be premature and we should wait for the peak. But the other three subcommittees were not on the same page.
Those from the Economic, Social, Cultural and Safety Disciplines subcommittees expressed their views that we should ease measures at least to a bare minimum in consideration of the damage to people's livelihoods and small business owners, when it's still uncertain when our Omicron peak might arrive. We kept these opinions in mind in our deliberation process before making this decision.
Right, and so this ease in restrictions comes amid the current confidence, so to speak, in treatment capacity efforts here.
Looks so, because although the rise in cases appears to be faster than earlier predictions, health authorities continue to stress that there are enough medical centers and other facilities to manage people at highest risk. And Son Young-rae, another official at the earlier briefing, mentioned that a relaxation of business restrictions does not necessarily lead to a rise in patients in severe or critical condition, neither fatalities. So this was his explanation.
The effects of our social distancing measures could delay the arrival of our Omicron peak and help reduce the number of seriously ill patients at its height. But the number of severe cases in total throughout the duration of our Omicron wave could actually be more or less equal.
So basically saying it may be just a matter of whether the number of seriously ill patients will be concentrated at one point or dispersed over a longer period. And for now, with 50.5% of ICU beds in operation nationwide and no patient having to wait more than a day to get assigned to a hospital bed, the government maintains its view that medical capacity is at a stable level. However, they also predict the possibility of 2,000 to 2,700 patients being in serious or critical condition by the end of this month. Among the daily cases this Friday, close to 40,000 patients were aged 60 and above, or around 15% of today's caseload. More hospital beds, meanwhile, are to be secured within the next couple of weeks. Officials also noted that now some 88% of senior citizens aged 60 and above have received their additional COVID-19 vaccine dose, which should help in preventing a dramatic surge in serious or critically ill patients.
Right. And so one quick question before you go. I remember earlier this week you mentioned the possibility of Korea's home treatment patients surpassing the 1 million mark. Have we reached that milestone?
Not yet, Sunny, but we are close to that actually, because as of 12 a.m., more than 920,000 people are recovering at home. And if we consider the number of daily cases that we have posted this Friday, above 260,000, and if we have a similar number of such patients on the weekend, it is highly likely that we will surpass the 1 million mark on the weekend. Although we also do have people who, recover from their quarantine at home.
Right, of course. Right, and so as always, thank you very much for those updates. Have a safe weekend.
You too, Sunny.
We start our new segment in Eastern Europe, where delegates from Ukraine and Russia have agreed to allow for the passage of civilians to safety. Our Ji Young has the latest events with regard to Kremlin's aggression.
Ukraine and Russia ended a second round of ceasefire talks on the 8th day of Russia's invasion of Ukraine. Kyiv says the talks did not yield the results that it hoped for, but the two sides have agreed on a tentative plan to create a humanitarian corridor for evacuating civilians. Russia's negotiator described it as substantial progress.
So the sides, representatives of the Defense Ministry of the Russian Federation and Ministry of Defense of Ukraine, have agreed on the format for humanitarian corridors for civilians to leave and possibly stopping military action in the area as civilians leave. I think it is substantial progress.
Despite peace talks, Moscow's forces carried on with assaults on Ukrainian cities, including Mariupol, which is the main port city in the east. Russian military have also entered the southern city of Energodar near the Zaporizhia nuclear power plant, the biggest in Europe. A local official says the power plant is on fire amid a Russian attack and the radiation level at the site has reportedly gone up. Russian forces said they had seized Kherson on Thursday, the first major Ukrainian city to fall, and have taken over local government headquarters in the Black Sea port city of roughly 280,000 people. Also, Ukraine's second largest city, Kharkiv, was continuously bombarded. Around 1 million people have fled Ukraine, according to the United Nations, since the start of the Russian attack. Ukrainian President Volodymyr Zelensky said he's willing to have an open conversation with Russia's President Vladimir Putin.
It's not about I want to talk with Putin. I think I have to talk with Putin. The world has to talk with Putin because there are no other ways to stop this war. That's why I have to.
As the war advances, the U.S. created a new hotline with Russia's Ministry of Defense on Thursday in order to prevent miscalculation, military incidents, and escalation. 엄지영, Arirang News.
And in response to that fire at Europe's largest nuclear power plant after heavy shelling by Russian forces, U.S. President Joe Biden has called for an immediate halt amid concerns of a potential nuclear mishap. His administration, meanwhile, has declared additional penalties on prominent Russians with close ties to Vladimir Putin. Kim Hyo-san reports.
The Biden administration has imposed sweeping sanctions on 19 wealthy Russian individuals and 47 of their family members, as well as their close associates, as part of additional U.S. penalties on Moscow for invading Ukraine.
What we're talking about here is seizing their assets, seizing their yachts, and making it harder for them to send, their children to colleges and universities in the West. These are significant steps that will impact the people who are closely around President Putin.
They include the Kremlin spokesperson and Alisher Usmanov, one of the wealthiest men in Russia. Britain has also newly sanctioned 2 billionaire allies of Putin, including the former deputy prime minister of Russia. They'll be subject to full asset freezes and travel bans. These individuals have already been sanctioned by the EU. Brussels is also seeking to remove Russia's most favored nation status at the World Trade Organization. The move is expected to sharply hike tariffs on Russia's exports to the EU. It also said it's ready to take additional steps against Moscow if needed.
And we will take additional steps if the situation deteriorates on the ground. At the same time, we are preparing in case of retaliation. In particular, we are working to diversify our energy supplies. We discussed it.
Meanwhile, the UN nuclear watchdog says its board of directors has backed a resolution condemning Russia's invasion of Ukraine. The resolution calling for Moscow to let Ukraine control all its nuclear facilities was passed on Thursday at an emergency meeting of the IAEA. 26 of the 35-nation board supported the resolution. Russia and China voted against it. Kim Hyo-san, Arirang News.
Here on the local front, early voting for the presidential election is well underway, as we mentioned earlier. And to ensure a safe event, our Song Yu-jin reminds us about the protocols in place for those under pandemic-related quarantine.
Early voting for South Korea's 2022 presidential elections kicked off today ahead of Election Day on March 9th. This time round, voters have more to worry about than which of the candidates to choose. What should need to be done if you test positive for COVID-19 or have to quarantine? The Korea Disease Control and Prevention Agency has laid out the election guidelines in answer to that question. Number 1, where and when can you vote? Those who have contracted COVID-19 or are under quarantine can vote on the second day of the early voting period, March 5th. They can leave for the voting booths from 5 p.m. and cast their ballot until 6. For those who plan to vote on the actual election day, March 9th, they can vote between 6 and 7:30 p.m. Public health centers will be sending text messages with more information on the time these people can go out to vote. In terms of at the voting venue, COVID-19 patients and those in quarantine will be designated separate voting booths. Number 2, what if you test positive on voting day? If a positive test result is received on the day, voters should show relevant text messages sent by public health centers or medical clinics. And with a personal ID, one can vote at separate voting booths during the permitted hours. However, if a voter tests positive through rapid antigen test only, they may vote during regular voting hours from 6 a.m. to 6 p.m. Number 3, what if you have symptoms but test negative? If you have a high fever or respiratory symptoms that make it difficult to go out, you should stay at home. Number 4, what if you live with someone who has tested positive and your self-monitoring period is not over? In this case, the advice is that you should refrain from going out. However, you can vote as long as you take necessary precautions, such as wearing a mask, and go when not a lot of people are at the voting stations. Finally, even if COVID-19 patients and those under quarantine walk, drive, or ride designated COVID-19 taxis to polling stations, visiting other venues such as coffee shops or banks is prohibited. Any violation of these protocols can lead up to imprisonment for up to a year or a fine up to 10 million Korean won or some $8,250 US. 송유진, Arirang News.
Surging global oil prices amid rampant geopolitical concerns are pushing up consumer costs here in the country. Kim Sung-min has details.
South Korea's consumer prices rose more than 3% for the 5th straight month in February, largely on the back of surging energy costs. According to Statistics Korea on Friday, the consumer price index last month came at 105.3, up 3.7% on year. Industrial goods, especially petroleum products, drove the surge. Gasoline rose 16.5% and diesel 21%. That figure could rise further in March as global oil prices are skyrocketing amid extreme volatility in the global energy market. The Ukraine crisis is adding to already high inflationary pressure, with Brent crude futures nearing $120 a barrel during the session on Thursday. South Korea's benchmark Dubai crude also topped $112 a barrel on Wednesday, the highest since 2014. Services saw some high inflation too, with the price of dining out rising more than 6% due to surging costs of certain fresh products like fish and beef. But overall, the inflation growth of agricultural and fisheries products somewhat slowed down, rising just 1.6%. There was far less than the more than 6% growth in January. Core inflation, which excludes volatile food and oil prices, rose by more than 3%, suggesting that the current inflation is widespread across all sectors.
While inflation was more apparent in certain sectors, it has spread across all sectors, driving up core inflation and producer prices, and especially consumer prices.
The government says consumer prices are expected to rise further due to surging prices of grains following the invasion of Ukraine, as well as disruption in global supply chains. Kim Sung-min, Arirang News.
In other news, the pandemic appears to have prompted yet another intriguing consumption pattern. Many are choosing to buy more chairs. Arirang explains.
Working from home is changing our working environment more than ever. According to the Bank of Korea on January 20th, a total of 1.1 million people now work from home. That's 12 times more people than in 2019. With this phenomenon, South Korea is seeing a dramatic increase in sales of desk chairs for use at home. One of the country's major chair companies reported that sales of its most popular product rose around 70% in 2021 compared to a year earlier. Even sales of high-priced luxury products jumped 30% during the same period.
As more people are working from home and students are taking online classes, lots of people come to look for chairs that can be used at home. The store has seen a roughly 10% increase in sales in 2021 from a year earlier. Sales of chairs for students rose more than 15% in the same period.
Other products that are related to sitting are also seeing a hike in sales. According to the company, sales of accessories such as seat cushions and footrests also jumped 170% last year. When it comes to creating a work-from-home environment, desk chairs now come in various different forms. This product, for example, has been designed so that anyone can easily assemble at home. And as economy emerges, which is a combination of the words sitting and economy, consumers are looking for products that can help boost their productivity when working from home. Industry experts have been calling this trend the sitconomy and say it could continue for several years.
As homes are transforming into offices, cafes, cinemas, and more, a rise in demand for comfy office chairs and furniture is expected. Also, more people are getting to know the importance of sitting posture, which is closely related to their health.
The expert added that more chairs that can provide optimal body support and an effective working environment are expected to be released to meet consumers' needs. Lee Dae-hyun, Arirang News.
Among the many disruptions brought on by the pandemic are those related to learning among children. For more on this, I have Professor Kim Hyun-chul at the Hong Kong University of Science and Technology live on the line. Professor Kim, it's a pleasure to have you on.
Hi, Sunny.
Now, thank
you for having me.
You're most welcome, Professor Kim. But before we touch upon the challenges within the learning environment amid COVID-19, do briefly tell us about the pandemic situation in Hong Kong, Professor Kim. I understand authorities recorded a record high of over 56,800 new infections this past Thursday.
Right. So Hong Kong has more than 50,000 cases yesterday. But the expert calculate the actual number of COVID-19 infection is about 5 to 6 times bigger than the confirmed number, which means that every day we have about 300,000 people newly infected. Korea is 7 times bigger than Hong Kong in terms of number of population. So this number is equivalent to 350,000 in Korea.
Right. Professor Kim, authorities there have spoken about plans to conduct compulsory testing of the city's 7.4 million residents, and schools, I understand, have been shut down to be used as response centers. Could you tell us a bit more about that?
Right. So today, Chief Executive Carrie Lam has insisted the whole city lockdown will not happen. But the local schools are all closed since February, while international schools in Hong Kong are doing online.
Right, and staying within the academic arena then, I believe you recently conducted a study, Professor Kim, on the repercussions of restricting access to education on Korean students amid this particular pandemic. Could you tell us a bit about your findings now?
Right, yes. I studied the impact of school restrictions in Korea on academic outcomes of high school students. In the beginning of the research, I was really worried about the learning loss in Korea. But I find out that on average, there is no such negative impact, which is good news. However, I also find that high performers, they performed even higher during the pandemic, but the low performers performed worse. What does it mean? Inequality of education outcomes significantly increases.
Right, and compared to their counterparts elsewhere, Professor Kim, do Korean schools possess certain features perhaps that makes them or renders them more vulnerable to pandemic-related restrictions or not?
Right, so the number of school days in 2020 in Korea was about 105 in high schools and 86 in middle schools. Before the pandemic, it was about 190. The number of school days during the pandemic is lower than the more advanced countries, like most European countries and Japan. But the corresponding numbers in developing countries are much lower than the South Korea. So Korea was kind of trying to doing well, but not as good as the more advanced countries.
Right. Professor Kim, there are concerns about sending children to school amid Omicron, given the low vaccination rate among them here in the country. What are your thoughts on that?
Right. So that is the biggest misunderstanding. So the first reason is that the school closure has no impact in terms of COVID-19 infection. Why school closure is not helpful? That's because students not going to school does not mean they stay at home all the time. If they meet the friends outside the school, school closure is meaningless. The school that follows the social distancing could be safer than to the children. And I want more reasons. Omicron virus is not dangerous for students. Do you know that how many school-age children passed away due to the COVID-19 infection in the last 2 years? The answer is 1. Only one student passed away because of the COVID-19 infection. But what about the car accident? How many students have died because of the car accidents in Korea? It's 100. In the last 2 years, 200 students killed because of a car accident. But nobody decided not to go to the school because of the fear of the car accidents. But actually, car accident is 200 times more dangerous than the COVID-19 infection for our students.
Right. So, Professor Kim, essentially speaking, you believe that access to schools should be allowed amid the pandemic, as children are less vulnerable to severe illness amid the presence of Omicron, then?
Absolutely.
Right. Now, keeping in mind that quite a number of them here in the country have not been vaccinated, what safety protocols would you then recommend for safety within the academic arena?
Right. And do you think it is possible to avoid COVID-19 exposure? Exposure and infection is different. Exposure is you meet the viruses, and infection is you got infected viruses. And number of infections in Korea is now about almost on average 300,000 per day. But actual number is 2 million per day. How long the infected people are contagious? It's about 7 days. That means that 14 million people, 30% of population in Korea, can spread out the virus as of now. It means that it is almost impossible to avoid the exposure to the viruses. But if you are vaccinated, then you are much less likely to infect it. So exposure to the viruses is inevitable. So that is number one. And what are you going to do at the school? As the Omicron virus is not dangerous, my recommendation is that although it is mentally difficult, just forget about the viruses at least for the students. If your children is sick, take a rest at home. Go to the hospital. If your children is very sick, PCR test is not necessary. Nothing gonna change nothing gonna change for your children when they detect the Omicron virus infection. It just jeopardizes the school program. So my strong recommendation is just forget about the viruses for the students.
Right, I see. All right, Professor Kim, thank you very much for your time and your thoughts then.
Thank you.
As of this week, the academic arena here in Korea is open, and for now, the decision, or the right that is, to decide on the method of learning has been granted to school authorities. For more, I have Professor Kim Min-kyu from Yonsei University. Professor Kim, it's good to have you with us.
Great to be here again, Sunny.
I also have Professor Choi Young-jun at Korea University live on the line. It's been a while, Professor Choi. Welcome back.
Thank you for having me here.
Right, Professor Kim, those aged 18 and below, that is, or below 18, I would say, account for at least 24% of all infections here in the country, while those aged 60 and above who have been boosted account at most for 10% of all infections. I suppose this particular finding itself reflects the importance of inoculation.
Yeah, the original Wuhan strain was relatively infecting the aged group, sparing the children. And it's not for the Omicron. And, as you know, there are many mutations in the S protein. And I think that's one of the reasons that more children get infected. But also, the vaccination clearly played a role preventing infection, especially severe infections. And as most of the children are not vaccinated yet, that will be the reason why, one of the reasons why more children are getting infected. But I already mentioned many times that more and more time goes by, we should be focused on severe cases, not the total number of cases. And booster shot issue is still not determined yet for the children, so it's very hard to say what we're going to do with the children not vaccinated or vaccinated twice. So that's the reason I'm waiting for a clinical study with Novavax, which might be have less side effects for children, and also for the long-term effects is not clear.
Right. Professor Cho, what, meanwhile, is your outlook with regard to infections among the young here in Korea as we slowly but steadily head toward our own Omicron peak?
So, as in many parts of the world, we are experiencing more and more of the COVID cases in children. And it's also happening in Korea as well here. And there may be a couple of reasons why. First, because the adults are now vaccinated and are being boosted against the COVID, and the virus will probably look for the places where they can find the infection, which is the children who are not vaccinated. Another part is that the children are by nature very susceptible to the respiratory virus infections compared to the adults, including non-COVID coronaviruses that can cause the common colds or respiratory infections. So I think there is a good explanation why COVID is increasing in children and why it could furthermore increase in the kids in the coming months.
Right, so essentially speaking, Professor Cho, you do expect a further increase in infections among children as we have started our academic year?
Correct.
Right. And Professor Kim, starting this month now, regardless of vaccination status, a person residing with a COVID-19 patient and who has tested negative, of course, is not required to quarantine. How does this ease in prevention measure look to affect public or pandemic safety within school grounds?
Well, if you do not quarantine a person who is exposed to confirmed cases, that kind of policy will increase the cases. But it does not mean that it's going to be a dangerous situation in schools. It's dangerous for only risk group, especially in children. We worry about severe obesity, diabetes, congenital heart disease, chronic lung disease, and epilepsy. And one more thing, we have feeding tube dependency. And most of these patients do not go to school, so that's something good. Children may be asymptomatic or even have a mild common cold or mild intestinal flu. So I think there's no need for testing family members if the symptoms are mild or negligible. Under current policies, it is inevitable that all the students are going to be gradually exposed to Omicron, just as Professor Kim in Hong Kong mentioned. And I'm worried that there's a big confusion in the school managers, because they have to decide for themselves about what they're going to do with students happening or not. But anyway, we have to keep on the basic rules, wearing masks and hand hygiene, distancing, disinfecting the facilities if needed, with students attending schools.
Right. And Professor Che, how do the potential risks of in-person learning amid Omicron, that is, compare to such learning efforts during our earlier waves of COVID-19?
So, yes, you're right, so that I think the Omicron is obviously very different from the original strain that was isolated from Wuhan or even the Delta strain. So we are facing a very different virus. So I think children who go to the elementary schools have not been given the chance to vaccinate as of now, and given that more and more cases are growing in this population, I think it is reasonable to say that there will be more cases when the kids go to schools. But when we look back how we handled the schools over the past 2 years, kids were not allowed to go to school in many parts of the world, including Korea. They had not had the right to be educated or play with their friends, get socialized, or being taken care of by when they are needed. So if we compare the numbers, the risk of getting really sick because of the Omicron COVID versus not going to the schools, getting the unequal the chances of learning, I think not going to school causes much higher burden than having a chance of getting COVID, as Professor Kim from Hong Kong University have mentioned. So I think the vaccine will be a good available option really soon and can provide a good protection to children in that sense.
Right. And Professor Kim, what, meanwhile, are your thoughts on current government efforts here aimed at treating children with COVID-19?
Well, they recently informed that there is going to be about 26 clinics or hospitals responsible for COVID-19 cases. It's very encouraging that we do have it, but so the size of our population is huge, so we need more than that. Actually, I tried to find the information about those 26 centers, but it was very hard. I don't know how to get it. Maybe you may have to contact 119 or something to get those informations. Already, most of the clinics or emergency departments are very busy getting phone calls from the parents whose children is sick due to Omicron, and there's a huge limitation in communication by phone, especially if the children cannot speak and express how they feel. So it's very dependent on the caregiver's insight. So recently we started to use a phone plus webcam before we start the face-to-face physical exam on emergency department to triage, to decide whether this patient is urgent or not. I think we need some kind of similar methods for those 26 clinics. That might be helpful.
Right, which is probably why, Professor Che, health authorities here are actually working, that is, to ensure in-person COVID-19 treatment for children instead of opting for the remote option. Could you further explain these efforts for us?
Correct. So as a pediatricians, we are seeing the kids ranging from little babies to huge teenagers, same by the size of the body. And as in most age groups, our patients cannot usually express their distress or symptoms that can be easily seen by their parents or untrained persons. So as the clinicians, we are here, and it is very important to watch your child very carefully, ask the parents how they are doing, and examine the kids with our eyes, our ears, and hands to find out how we can help these kids. So I think it is quite important that in many cases, in-person medical treatment is very important. But as Professor Kim has mentioned, I think if it is not feasible in some cases, still non-in-person medical treatment can be also an option here, I think.
Right. moving forward, Professor Kim, and back to the idea of vaccinations, of course, Korea has recently granted the green light for vaccines for children aged 5 to 11. Having said that, what can you tell us about the efficacy of COVID-19 vaccines for this particular age group?
Well, until now, only Pfizer is authorized to use in 5 to 11 years age group, and they're using only 1/3 of the dose of adults, which means only 10 micrograms. There's only a small number in this study, and it's all preliminary data that, but it says that about 90% effectiveness, but it is getting weaker by time. So we don't know whether this dose is enough. If we increase the dose, we have to worry about the side effects and still unknown long-term effects. If we want to maintain this, we might have to do something more, giving second shot, booster, and whatever. And we don't know why this kind of phenomenon is happening. And there's one more issue currently published in a medical journal. And there was some autoimmune hepatitis after Pfizer vaccination, and the scholars look into this, why this kind of thing happens, and they realize that if you have a Pfizer shot, the lipid nanoparticle is in your injection site, and the second site is the liver. And they realize that those particles go into the liver cells, and some of them actually change the DNA expression, and we don't know what's going to mean. It's just the preliminary data. So I just want to say that the Pfizer vaccine we are using right now, we are not sure about the long-term effects. Let's say for adults, you may worry about 10, 20, or 30 years, but if you give it to children, you have to think about 50 years, 60 years, or even longer. So we have to be very cautious giving this kind of new vaccines, especially in a short period of time.
Right, and staying with the concerns raised by Professor Kim, Professor Che, based on studies overseas, what more can you tell us about the vaccination side effects among children?
So I can't agree more with Professor Kim that we should be very cautious to the children's safety in terms of the vaccines, because thinking about the vulnerability of this population and how long they're going to live compared to us. And also they can't choose to get vaccinated or not, just unlike us. But from the clinical data and the scientific perspective view, the vaccines are very safe to the kids at this point that we are seeing from the data that was shown in the clinical trials. That shows very few mild symptoms, including above 30 to 40% getting tired, the small chills in small portion of people who got their vaccines. And these symptoms do not usually last long, usually disappear within like 3 or 4 days. From the field trial that we can detect more of the serious but rare adverse events. They have been seen in a few cases, but usually didn't cause big trouble, and also was very few compared to other age groups. So I think at this moment, at least we can say that the vaccines in short term are safe to the kids.
Right, and staying with that, Professor Che, what are your thoughts on booster shots for teenagers?
I think the government has not yet decided to give the booster shot at this moment, but they are discussing actively now. I think they might do that because there have been seen the effectiveness of vaccines do wane over time without the booster, and will provide a better protection, even especially in the current the variant of the Omicron that have been dominating since the January of this year. So I think it might provide a better protection if the child has received the vaccine for more than 3 to 6 months.
Right. And Professor Kim, moving forward then, what would be your words of advice to share with those who are taking care of children infected with COVID-19 at home?
Well, I wish that government may give more clear indications whether you're going to have the test or not. My personal opinion, if the symptom is very mild or tricky. I mean, you don't know whether I having a symptom or not. I don't recommend to go on testing. So anyway, if you have fever, sore throat, coughing, and abdominal pain or something else, then you better start quarantine yourself or your children. For the caregiver has to wear mask, the children has to wear mask. They should stay in a separate room, and all the cups, dishes, and towels should be separated. And whenever possible, you should keep a 1 meter distance from the children. And only one caregiver should be responsible for the children who is getting infected. Open your windows as much as you can for ventilation, and you better stay home. You know, all the words that I'm mentioning is about the general rules. I mean, not only for the Omicron. If you get a fever with some kind of flu, we should follow this kind of procedures. So keep these rules, keep hydrated, and you should know the phone numbers you have to call for those 26 hospitals, the centers you may have to contact. And if you have underlying conditions that I previously mentioned, you better contact the hospital you are attending or visit the emergency department.
Right. And Professor Che, what would be your words of advice to school children who are required to attend school but are living with perhaps a confirmed patient at home?
I think for the school children who do have any confirmed patient at home but have to go to school, can still have to go to school because it provides much better benefit, which outweighs the cost of not going to the school. When we consider the severity of the Omicron variant and the cost that we have to pay for that. But for the safety measures, I think still what Professor Kim has mentioned all applies to the school children who go to the school. They have to keep their personal hygiene, including hand washing. Of course, the mask is still the new normal that we have here, and the classrooms have to keep the fresh air with the good adequate ventilations. And also with a good disinfectant, the cleaned surface of the desk and the surfaces of the atmospheres. So all those the criterions and all this the guidelines that we have to follow still applies within at least for the next few months.
Right, they do. All right, Professor Che, thank you very much for your time and your thoughts. Professor Kim here in the studio, thank you for your insight today.
Thank you very much.
Right, drinking and dining establishments here in the country can accommodate patrons until 11 in the evening starting tomorrow. That would be Saturday. Now, the ease in social restrictions comes with a greater call on personal responsibility, so do take care.